Hey everyone, Beebs here. In today's video, I wanted to focus in on one of the many Democratic candidates running for the presidency in 2020, a former San Francisco District Attorney and California Attorney General, current California U.S. Senator Kamala Harris. You may be wondering why I chose her specifically out of the 20+ candidates fighting for the White House. After all, she's only been a politician for 2 years and hasn't really achieved much in Congress since being elected senator. Well, I see a lot of similarities between her and former President Barack Obama, namely a fresh, one-term senator with a fair deal of charisma and intersectional advantages. In a nutshell, I think Harris has a lot of political currency to spend despite her lack of experience. But why exactly? Well, it's pretty clear that in the age of woke, progressive politics, the Democrats are chomping at the bit to elect the most progressive candidate possible. And who better to take on an old white man than a younger woman of color? The left has been really salty after then candidate Donald Trump managed to defeat Hillary Clinton in 2016, but Harris gives them an opportunity to not only take down Trump, but achieve 2 historical firsts, electing the first woman president and one of color to boot. Still, it won't be easy for her to beat Trump in 2020, not only because there are more than 20 other people trying to steal the spotlight, but also due to the fact that she's already become a figure of steady controversy for several reasons. I could delve deeper into her questionable rise to authority through sexual affairs, or how she often becomes disingenuous when trying to play to her potential black voters, but for the purposes of this video, I wanted to focus on one particular issue that I think best illustrates her inability to hold a consistent position on what will be one of the top issues come 2020, healthcare reform. Back in 2017, long before she announced her bid for the White House, she stood beside fellow Democrats to co-sponsor Bernie Sanders' Medicare for All Act, a bill which would lead to the abolition of private health insurance.
And we should not differentiate in the way that we do public health policy. We should understand everyone, all, should receive the health care they need regardless of where they live, their income, or their zip code. And that's what this bill is about, and I am proud to co-sponsor it. It is about saying that this is about a right, not about a privilege for a few. It's a better return on the investment for the American taxpayer, and that is why I'm proud to stand with my colleagues and friends and support Medicare for All. Thank you.
Seems pretty cut and dry. Fast forward to the election season, however, and it starts to become pretty clear that Harris is not willing to stand behind abolishing private health insurance to make way for Medicare for all. She reaffirmed wanting to, quote, eliminate all that when pressed on people keeping their private plans, but backtracked over the coming days. Watch these 2 clips and judge for yourself.
Just to follow up on that, and correct me if I'm wrong, to reiterate, you support the Medicare for All bill, I think initially co-sponsored by Senator Bernie Sanders. You're also a co-sponsor on it. I believe it will totally eliminate private insurance. So for people out there who like their insurance, they don't get to keep it?
Well, listen, the idea is that everyone gets access to medical care. And you don't have to go through the process of going through an insurance company, having them give you approval, going through the paperwork, all of the delay that may require. Who of us has not had that situation where you got to wait for approval and the doctor says, well, I don't know if your insurance company is going to cover this? Let's eliminate all of that. Let's move on.
I want to ask you about something you said that night. You said on stage with me in January that when it comes to private insurance, quote, let's eliminate all of that, let's move on.
Yes.
Now you later said we don't need to get rid of all private insurance. So
But let's clear that.
Which is it exactly?
We were together.
Yes.
And you'll remember, and roll the tape, please.
Yeah, we can roll the tape. Well, you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for All, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch the tape, I think you'll see that there are obviously many interpretations of what I said. What I meant is let's get rid of the bureaucracy. As it relates to Medicare.
But the bill gets rid of insurance.
But no. It does not get rid of insurance. It does not get rid of insurance. And listen, and let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for All. It is my preferred
As a principle, you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Well, because the bill gets rid of private insurance for everything
It doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all...
So it doesn't get rid of all insurance.
Okay, it doesn't get rid of all insurance.
Right.
Yeah, not so cut and dry anymore. Notice her confidence regarding the issue evaporate once the rubber hit the road, and all we're left with is a convenient smokescreen as she backpedals. Kind of makes it hard to get a clear read on what she advocates. This wouldn't be the last time she wavered back and forth on the issue either. Take a look at this clip from the first Democratic debate a few months later.
This is going to be a show of hands question. We asked a question about health care last night that spurred a lot of discussion, as you know. We're going to do it again now. Many people watching at home have health insurance of their employer. Who here would abolish their private health insurance in favor of a government-run plan? All right.
I remember watching that debate live and my mouth dropping when I saw both Sanders and Harris raise a hand, but I would be even more dumbfounded after Harris backpedals again after the debate on Morning Joe.
Senator, on health care last night, you were asked to raise your hands, the entire panel, 10 of you, if you believe eliminating private insurance should be part of the Medicare for All proposal. You and Bernie Sanders both raised your hands. You've been asked and sort of clarified this question a couple of times over the course of the campaign. So once and for all, do you believe that private insurance should be eliminated in this country?
No.
You don't?
No, I do not.
But you raised your hand last night.
But the question was, would you give up your private insurance for that option? And I said yes.
Oh, I think you heard it differently than others then.
Probably, because that's what I heard. But yeah, but I will tell you.
By the way, can we have a rule, by the way, in future debates? No more hand raising.
Yeah. Oh, that I were running the debate.
Give me a break. The question was in regard to viewers watching with health insurance from their employer and whether the candidates would abolish their, as in those aforementioned people's, insurance in favor of a government-run plan. I realize that the wording was a little weird, but it doesn't even make sense in terms of politicians who don't have private health insurance to begin with, but rather government-run plans. And if there were any misgivings about the question asked, would it really hurt her or anyone to clarify before answering? Once again, we're left unsure where she stands. I suppose we could stop relying on sound bites and just go to her website in hopes of gaining some clarity on the issue. So I did. www.kamalaharris.org/healthcare gives us more information on this 10-year transition toward Medicare for all, but it's just as confusing as everything else. For purposes of context, I'll read through the 3 phases of this plan in their entirety, stopping every so often to break things down. The page states, first, when we pass my plan, all Americans will immediately have the ability to buy into Medicare. This is similar to the immediate introductory buy-in provided by Senator Sanders' Medicare for All bill. Right away, it will lower costs and give us a baseline plan as we transition to Medicare for All. Nothing too controversial there so far, so let's continue. Second, we will set up an expanded Medicare system with a 10-year phase-in period. During this transition, we will automatically enroll newborns and the uninsured into this new and improved Medicare system, give all doctors time to get into the system, and provide a common-sense path for employers, employees, the underinsured, and others on federally designated programs such as Medicaid or the Affordable Care Act exchanges to transition. This is where things start to get a little questionable. If employers, and by proxy employees, are given a path to transition into the government program, doesn't that imply that the purpose is to eventually phase out employee-based insurance? I mean, if the government can get everybody into the system by using taxpayer dollars to subsidize insurance and therefore outcompete private options, doesn't that, in effect, eventually drive those plans out of the market? Just a thought. Let's keep going. This will expand the number of insured Americans and create a new viable public system that guarantees universal coverage at a lower cost. Expanding the transition window will also lower the overall cost of the program. I'm not sure what she means by expanding the transition window here. Is she simply referring to the 10-year transition or proposing to increase it further? Anyway, moving on. Third, in setting up this plan, we will allow private insurers to offer Medicare plans as a part of this system that adhere to strict Medicare requirements on costs and benefits. This would function similar to how private Medicare plans work today, which cover about a third of Medicare seniors and operate within the Medicare system. Medicare will set the rules of the road for these plans, including price and quality, and private insurance companies will play by those rules, not the other way around. This preserves the options that seniors have today and expands options to all Americans, while also telling insurance companies they don't run the show. So basically, this would be a continuation of how Medicare works right now. The system would make doctors and insurers jump through a bunch of hoops and offer crappy reimbursement rates, thus defeating the purpose of even working through Medicare in the first place. Since doctors already refuse Medicare patients if the rates are too low, won't this broader application further limit access to healthcare within the system? Unlike the current system, private plans in the new Medicare system will be held to stricter consumer protection standards than they are today, such as getting reimbursed less than what the Medicare plan will cost to operate, to ensure that they are delivering meaningful value and unable to profit off of gaming consumers or the government. People will also be able to purchase supplemental insurance covering services not included in Medicare, such as medical insurance for traveling abroad or cosmetic surgery. So restrictions will be greater and reimbursement will be worse than before? This sounds like a nightmare to providers, who already have to spend thousands of extra hours and countless dollars complying with the regulations already on the books. Now they won't be able to make a profit off gaming consumers of the government, whatever that means. Who's gaming who here, truly? Essentially, we would allow private insurance to offer a plan in the Medicare system, but they will be subject to strict requirements to ensure it lowers costs and expands services. If they want to play by our rules, they can be in the system. If not, they have to get out. Honestly, how on earth are doctors supposed to both lower costs while simultaneously expand their services? That doesn't make any sense. I think I've read enough. The whole plan stinks to high heaven. What Harris offers is an increasingly untenable plan that drives people into the system who can't afford to flee and burdens the industry with even more red tape. This causes more doctors to abandon Medicare patients and therefore shrink the system's capacity to provide quick, high-quality healthcare. Even worse, it increases taxes for all regardless of whether or not one participates in the system. Her plan doesn't claim to outright ban health insurance, but it sure is waging war against it, with the sole intent to undermine it completely over a prolonged period of time. Also, who's to say, halfway down the line, Democrats don't blame the private market on greedy doctors that turn too many Medicare patients away and call for the abolition of private health care anyway. I hope I haven't bored you all to tears by this point, but it's really important to break down exactly what Kamala and the Democrats will be pushing over the next year and a half. It's quite frankly the most radical I've ever seen the party, but that's only part of why it bothers me. The true concern is that voters will actually buy what they're selling. It's so much easier to convince people that they should have what they want than the opposite. And when entire generations of people have been indoctrinated with the notion that every entitlement is a right, how can you stop them from getting what they feel is truly owed to them? Even worse, they won't be getting what they want in the end. Every American wants access to quick, affordable, quality healthcare, but the government has never been able to provide it. Democrats may win power promising voters the world, but they don't have to deliver, and if I had to make a wager, I would say that they won't. Not 2 years from now, not 10 years from now. In closing, I hope this video has given you an idea of just how unworkable Medicare for All really is, but in case it hasn't, please consider the following questions. If we can't even provide quick, affordable, quality healthcare to our veterans who have sacrificed to protect our freedoms, then how is the government in any position to offer that same level of care to every single American? And finally, if we can't even take care of the suffering citizens of this nation, then how much worse off will we be trying to service millions of additional patients as they continue to illegally enter America? This is Beebs Magoo, signing off.
With those members of organized labor who have negotiated for plans and have in those negotiation processes often given up what could have been higher wages in exchange for a higher coverage for health care. And we have to address that. It's a legitimate concern which must be addressed.
The bill also says, quote, every individual who is a resident of the United States is entitled to benefits for health care services under this act. Not every individual who's a citizen, but every individual who's a resident. So you support giving universal health care, Medicare for all, to people who are in this country illegally?
Let me just be very clear about this. I am opposed to any policy that would deny in our country any human being from access to public safety, public education, or public health, period.